Welcome to July 2025. My name is Robert Tasker and I'm your Editor-in-Chief of Pediatric Critical Care Medicine. 3 features, 4 other clinical investigations, a PCCM conference report, an editorial commentary, an item on notes, methods and statistics, a narrative and some correspondence. So let's get started. 3 features. First, by Aziz et al., with an editorial by Tume and Su about POCUS for shock and hypotension in an emergency department in Malawi 2019. Secondly, Basu et al., along with an editorial by Wozniak et al., write about adjunctive corticosteroids in the PCICU, a 2020 to 2021 single-center retrospective cohort. Nellis et al. Write about massive bleeding in children with cancer or stem cell transplant, 2017 to 2021, a multicenter international study. In the 4 other clinical investigations, Carafelli et al. Write about focal cerebral infarct in ECMO in relation to cannulation, a single-center retrospective study, 2015 to 2023. Aldewarald et al. Write about pediatric sepsis phenotypes and outcome, a single-center study, 2010 to 2020, looking at day 1 to day 3 trajectory. This article gets my monthly prize for the best illustration. Look at the alluvial plot. Janus et al. Write about early biomarkers of MRI injury post-cardiac arrest. This is a secondary analysis of a 2017 to 2020 cohort on personalized outcomes. And fourthly, De Mayo et al. Write about DKA and venous thromboembolism in the VPS dataset from 2014 to 2023. In the other material, first, a PCCM conference report and expert panel comes from Faris et al. On the new PICU Data Collaborative. There's an editorial commentary by Sanchez Pinto et al. On group peer mentoring in career development. The item starts with a review of a recent randomized controlled trial that was published in another journal, and Sanchez Pinto et al. Talk about how this applies to their own practice. As a PCCM narrative, Mei Shum, a general pediatrician at CHOP, writes a poem on life and loss. And then in my item on writing for PCCM, I write about how reports about clinical trials, primary results, other material and secondary analyses should be presented in the journal. And lastly, the 2 sets of correspondence. First, there is follow-up material on the December 2024 article about nuclear medicine cerebral perfusion studies as an ancillary test to support evaluation of brain death and death using neurological criteria. And the other set of correspondence is about an item that appeared in the January 2025 issue about iron deficiency in patients both during and after PICU. So, great reads this month. Thank you very much for following PCCM. See you next month.